Good morning, Wakefield. This is Steve Mayo, your town administrator. I welcome you to what is going to be a weekly update at 10:30 on Friday mornings regarding the COVID-19 pandemic and status of where Wakefield is and any new information that we have and can give you. Joining us each week will be a different number of panelists. We'll have our health agent normally here, our emergency, Ruth Clay, our emergency management director, Tom Walsh. You may see town councilors, school committee members, superintendent of schools. Our communications director is here, and we're here to maybe give some, whatever new developments we do have, whatever new items are occurring in Wakefield, and we're also going to answer questions. We will ask that you use the chat function on Zoom to ask your questions so we can make sure, A, that we hear it and get it correctly, and that we can answer it correctly if you have any. So starting right now, I just want to introduce our health agent, Ruth Clay, who maybe can give us a few words about where we are. Unfortunately, Wakefield is in the red for the third straight week, and I think we're joining probably over 100 other cities and towns, many in our immediate area, that are also in the red. So Ruth, why don't I turn that over to you for some comments? Thank you.
Thanks, Steve. Yes, so if you look on the state's website, www.mass.gov, and you put into the search engine COVID map, it will bring you to the part of the website that shows the weekly map of status of individual cities and towns. And if you click on any individual city and town, it will give you individual statistics, such as total cases and things like that for that city or town. And as the town administrator noted, we are not alone in being the red status. Quite a few communities are at this point. When the state came out with this map, there were only 4 red cities on the whole map. And now, as he said, we have about 100. And again, a number of them, we are surrounded by red or yellow. We do have an outbreak going on in a long-term care facility that is contributing to our status of red. We would certainly be at least yellow without it, maybe red even without those numbers. Our community cases are increasing. And the difference in our community cases right now is that it's more than one person in a household. So when one person is positive and other household members get tested, at least one, sometimes 2 or even 3 other household members are positive. So that certainly increases our numbers fairly rapidly. Our cases have ranged from babies to elderly. There isn't one range of ages that's more than another, except for maybe like the 30 to 40-year-olds. But besides that, the numbers really range. The interesting thing that we are also posting every week is school numbers, and that's on our dashboard. I wanna just spend 1 minute explaining that number, because somebody is going to look at that number and look at the number on the DESE website and see that they don't match. And that is true. Our number is any student or staff who has tested positive, regardless of their learning model. The DESE number is only students or staff who have tested positive and have been in a school within the last 7 days. So if they're remote, they're not going to show up in the DESE number. neither number is going to include positive children or staff at private schools, and we do have private schools in Wakefield. We also have students that go out of town to private schools. Those students will not be included either, but as a Wakefield resident, they would be included in our total number. So now that I've confused you all about all the different numbers, the bottom line is use the numbers as a guideline, as a blunt instrument, but the numbers change, I would say, even more than daily, because we update our numbers several times a day. We get new cases all day, 7 days a week. So we do our best to give you the latest numbers that we have. Our public health nurse checks in to the state surveillance system multiple times a day and evening.
Thank you. Thank you, Ruth. I'm going to turn it over to Tom Walsh. He might have a few words to say, our Emergency Management Director.
Hi.
There you go.
Hello, everyone. Yeah, I'm just saying that I believe the town itself is in pretty good shape as far as public buildings, town employees, first responders. The thing that we do not control is the public. And I know that some people are probably becoming complacent or probably just fatigued by the length of this pandemic. You just can't give up. This is a marathon. It's not a 100-yard dash. And eventually we'll get over this, but it's going to take some time. So we're going to have the message boards out there just reminding you, washing your hands, cover your, use a face covering, social distance, don't gather in large groups. It's protection of all of us. And if we all band together and do the right thing, we'll get by this and stay as healthy as we can.
Thank you, Tom. I'm gonna jump onto that, because what we are doing is we are remessaging, redefining our message. I guess people do get complacent. They get complacent in following the message. They get complacent in listening to the message. So we're starting, it's all about the W campaign, which is wash your hands, wear a mask, watch your distance, Wakefield pride. And if we all do this together, this will make a huge difference. We see people out and about not wearing masks, although all of our public buildings and our private buildings are requiring people to wear a mask to get inside. Here at Town Hall, it's been actually quite a, for some people, that are coming in to vote, even they don't want to wear a mask, and we're telling them, no, you have to wear a mask when you're in this building. And, we're enforcing it and expecting all of our other places to enforce it. So all I can say is to the community is keep trying, keep doing this. I think what has been lucky, and I knock on wood on this, is that, and Ruth, correct me if I'm wrong, we haven't seen, a private event that has turned into a super spreader. Is that correct?
Yeah, yes, I would say that's correct.
But it is where, people are going back into the workplace, they're coming home, and maybe their, spouse is getting infected, their children are getting infected, and it's really tragic. But that's what I'm seeing from the numbers that are coming in. So I'm just asking the community, pleading with the community to please stay strong. As Tom mentioned, wear your masks, wash your hands, use the sanitizers, limit the times that you need to go out. I have a real problem with my 82-year-old mother who thinks she has to go to Market Basket every day to get the latest sale. We've had those conversations, and I'm losing the battle. So hopefully someone will help me. I'm going to send her to see Ruth pretty soon. But it's really difficult, and I get it. I get it, but we really ask people to try just to follow these orders. And what can you do? We are making we are limiting some areas as well. At this point, we don't plan on limiting parking around the lake. I think people need to take a walk. Actually, people have been pretty good, and maybe with some more messaging, they'll be even better about wearing their masks. I will tell you that a place that really irked me was the fact that some people decided it was a good idea to have a Halloween party at the dog park, where maybe there was close to 100 people there. in costume as their canines were. We are going to limit the dog park to 25 people, even though perhaps it could be higher, but I think that's a confined space and they tend to huddle together. And we're going to limit that right now to Wakefield residents only, and we will be checking that. I think we found anecdotally that a lot of the organizers of big groups there were from out of town, which is amazing to me. So that's going to be happening within the next few days. But maybe this is a good time to bring up the chart that says what is going to happen as we went from, because we're red and we're have to back up a phase. So maybe we can bring that up. Maybe Ruth, you can talk about this a little bit.
Sure. One thing I want to preface this with is that this does not take effect today. It takes effect on Monday. So we're fortunate in Wakefield that a lot of this does not apply to us. We don't have a roller rink or obstacle courses or laser tag or things like that. Our performance venues have been closed down and haven't reopened. So I would say that the primary difference for Wakefield is going to be that second line down, the outdoor gatherings in public settings. Again, the town has been really good about not allowing the big events that we normally have at the lake. So that's helped a lot. But as of Monday, that limit goes down to 50 people together as opposed to 100. If it's on private property, it doesn't change. It remains at 50. We do have a number of gyms, small gyms, some not so small gyms. That goes down from 50% capacity to 40%. We don't have museums. The restaurants pretty much stay the same. We don't have anybody that I know of with live music at that time. Excuse me. And we may have one, maybe two local clothing stores that won't be able to use their fitting rooms starting on Monday. Relatively speaking, I feel like not any huge major changes, but it does underscore that our numbers are going up. Even without a cluster, our numbers are going up. And I wanted to just take an opportunity to mention the schools, because I know a lot of people are looking at the schools. There was a lot of discussion before schools opened about which model to use. Is it safe for kids to be in school? Is it safe for teachers to be in school? And school has been in session in Wakefield for a number of weeks, but it's also been in session around the state, around the country, and internationally for quite some time. So we now actually have some real data to look at. And there's no data that's showing that school is a source of spreading COVID-19, either for teachers or for students. The student numbers that we have in Wakefield are not related to each other at all, with the exception of siblings. And we do have some siblings, but there are no cases of students contracting COVID-19 that we can see from each other. And I think that's a really important message. I know people feel strongly on every which side. Everybody wants to keep adults and children safe. And quite frankly, the children that we have that are positive have, for the most part, become positive from their parents. So the adult in the household is positive first, and then their children end up positive after that. So that underscores the importance for everybody, the adults in our community, to be really careful at work, really limit yourselves with socializing, stay within your bubble. We've all created bubbles with a couple of other families that we've been socializing with, and this is not the time to expand your bubble. So I just wanted to bring that in about the schools.
Excellent. I'd also point out that just so the community knows, and this has been discussed, is that a lot of our wonderful cherished traditions, the lighting of the holiday lights, the lighting Frosty coming, Santa Claus on the Common, the lighting of the menorah. Although the lights will still be lit at some point, the menorah will be lit if they want at some point. All of these other wonderful social gatherings, the holiday stroll, have all been, I wouldn't even say canceled because they weren't even allowed to be scheduled. It's a tough year, I get it. But we're not going to allow anything like that that could turn into a super spreader event, and that would be impossible to contact trace because we'd have people coming from all different directions all over the place. There'd be no way to get everybody's information when they're there. So I apologize to the community. I'm the bad guy. Please throw all the slings and arrows my way, but it is for everybody's best interest. I see that we have a couple of elected officials that are on today, if I can see the whole list there. Any town councilors that were on, do they want to say a few words of encouragement? Unmute yourselves if you do. Do I hear someone? Oh, you jumped way over there, Maureen. What happened? You were here, you jumped. Thank you.
I don't know. No, I just want to reiterate what I've said before. You guys are doing an amazing job, Ruth and Tom and Jen and the Board of Health and all the nurses and the school nurses and you, Steve, and your team. You're doing a great job. This was, I didn't know it was 100 other towns that went to their red, but I'm getting the frantic messages of all our surrounding towns and everyone. And so it sounds like we have a plan and people just need to keep on wearing those masks and limit, really keep social distancing. Because it's not easy, but you guys are doing the best that you can, and all of the social media that Jen's doing. This is great. Thank you for starting this. I hope it continues because I think it's good for people to be able to weigh in. So
Our plan is to have this every Friday at 10:30. Laurel, did you want to say anything?
I would just echo what Maureen has said. I also just want to add, today's the first snow. I think we've gotten used to some neighborhood bubbles, which is terrific. But I think as we start getting confused with cold symptoms, flu symptoms, other indoor allergies, that I think people just need to ramp up any indoor masking, even with folks that you've been comfortable with from time to time. And I can't tell you how impressed I am with the toll that the health department staff has managed, pretty much with grace. But please do know we're all in this together, and we'll get through.
Thank you, Laurel. And I do think that our the contact tracing that has been done through the health department is just unbelievable. Following up and making sure that they're, to the extent, warning people, making sure they're getting tested and taking care of themselves. It's really unbelievably fabulous. I don't see any questions in the chat. Does anybody else have any? Please, if anybody in the public that came in late, if you have a question, please use the chat. We'll try to answer it. But does anybody else have anything to say that's on the panel?
I just wanted to bring up another reminder that we are so fortunate in Massachusetts, and specifically in Wakefield. We have a free testing site just down the road in the parking lot of the Square One Mall. It's operated by the state, so it's free for anybody. You don't need a reason. It's open from 2 to 7 every day except for Sundays. It's open on some holidays like Columbus Day, it was open, things like that. It's quick. It's not the test that goes way, way up that is uncomfortable. It's super easy. Doesn't hurt. I've been there twice already, so I can attest the fact that it doesn't hurt. You get your test results the next morning for the most part. And so if you have any reason to suspect that you might be positive with symptoms or without symptoms, I highly recommend that you go. There are free testing sites all over the state. If that's not the most convenient for you, if you go onto mass.gov and put into the search engine, "Stop the Spread," you will have a list that comes up of testing sites all over the state. The closest to us would be Lynn and Everett, I believe. Again, every day in those communities, it's usually at a different site each day. Some of them are walk-in, some of them you need an appointment, but there's no reason not to get tested. It's free, it's easy, and it's the thing to do. And we've found a lot of positives of asymptomatic people. So I just wanted to put a shameless plug in.
Great. Great job. A couple of things that I did want to go over. A lot of information is available on the town website. We do have a COVID-19 hub that has a lot of information there. So if you click on that, you can get a lot of it, a lot of the pertinent data. And the other thing is that we do have a couple of events that are coming up in town that have to go on. Government needs to move on. Voting, for instance. People have been early voting here. That ends, I think, in a couple of hours. Then those that haven't voted, we do have drop box out in front that if you have your ballot, I would suggest, if you got your mail-in ballot, not mailing it back now because it may not get in time. We have a drop box there that just drop it in. It is secure. It's metal. The town clerk checks it often during the day. I will tell you this, that Halloween night, we're going to secure it because not that kids will be kids. Let's just put it that way. So don't come Halloween night and drop off your ballot come Sunday morning because we're going to make sure that that's safe and nothing happens to your ballots. Those of you that have early voted, or if you're thinking of running down in the next hour or so, everybody is checked in. Everyone was wear a mask. Everyone is maintaining 6 feet apart. We have, decals on the floor and what have you. So safe as we can. On voting day at the Galvin, those of you that voted in, I think June, we held that election. Same thing. It'll be very safe. There'll be sanitizers. You're gonna have to wear a mask and stay separate. Town meeting. We have to have town meeting. We need to set a tax rate. We have items that need to be taken care of. The high school field house, which has is a huge expanse, has huge high ceilings. We'll be having the meeting in there. The ventilation system has been checked. Everything that needs to be running is running. I'm even going to have an HVAC guy on staff that day to make sure if for some reason one of the exhaust fans stops or blows a fuse or something, he'll be there to fix it. People will be spaced like they were in the June meeting, more than 6 feet apart. It'll be very much the same way it was then. Everyone will have to be masked. However, where it is a voting issue, there will be an area for people that can't wear a mask because they have a health issue in a separate spot. If you still don't feel comfortable going inside, okay, we will have tents outside as we did in the June meeting. I think it'll be a bit cooler than it was in June. I think it was 95 degrees that day. I think it'll be hopefully in the 50s or 60s. We will have heaters for people that are cool, but if you want to stay outside, again, socially distanced, we're doing everything we can to keep people safe and protect their right to vote. So those are two events that we will have to have. I feel very confident that we're doing everything we can, and so no one should feel that their voice can't be heard. So with that, does anybody else have anything to add? Okay, seeing that, we will be on again next Friday morning at 10:30. Superintendent will be joining us. He had another obligation today, so we couldn't. But if you have any questions that didn't get answered, or if we missed something, please go to the town website. All of there's availability to email us at any time. So thank you, everybody. Stay safe, wear a mask, wash your hands, watch your distance. Wakefield Pride. Thank you.
Happy Halloween.